handing the room. Okay, so I check the medical record. I perform hand hygiene and put on PPE if needed. I provide privacy. I introduce myself. Hi, my name's Brittany and I'm going to be your nurse today. I identify the patient with 2 identifiers. Can you tell me your name?
Alexandria David.
And then your birthday?
August 3rd, 2003.
Okay, so then I explain the procedure. We're going to be doing a head to toe assessment today, and then I make sure I have all the equipment needed. First, I'm going to start by asking some subjective data. So, have you ever had any head injuries or neck injuries or any surgeries?
No.
Okay, do you have any dizziness, headaches, seizures, or tremors?
No.
Do you feel any muscle weakness in any of your joints or muscles?
No.
Do you have any difficulties performing ADLs?
No.
Do you have any difficulties swallowing or speaking?
No.
And are you on any medications?
No.
And how is your self-care?
Good.
Okay, so I'm going to start by inspecting the patient. Her appearance, I notice that her posture, she is erect and relaxed. She does have the hiccups right now. For her dress, it's appropriate for the assessment. Her hygiene is clean. And her movements are voluntary. And then for her behavior, she's alert, no signs of lethargic. Her speech is nice and clear. And mood and affect, she is her body language and facial expressions are appropriate. For cognition, she knows her name. Do you know where you're at?
Yes.
Where are you?
At my house.
And do you know what month it is?
March.
Okay, so she's alert and oriented ×3. Do you remember what assessment I told you we were doing today?
Head to toe.
Okay, so her memory is normal for short term. Her attention span, she's not all over the place. Her thought and process is normal and she's not rambling all over the place. Her sentences are appropriate. Do you have any suicidal thoughts?
No.
And do you ever experience any anxiety, depression, or anger?
No.
Okay, and then for her Glasgow Coma Scale would be 15, fully alert. So now I'm going to start with her head. I notice that the patient has a normal cephalic. It's round. Do you have any pain or tenderness on your head?
No.
Okay, I'm going to start feeling your head. So I don't feel any lesions or masses, no lice. Her temperature, she is warm. There's no moisture. I'm going to palpate her temporal artery. And that's a 2+. I'm going to do her temporal mandibular joint. Can you open your mouth for me? And then close it. There's no signs of clicking. Her face, I don't notice any abnormal swelling. And her movements are voluntary and no signs of respiratory distress. Then I'm going to start with her eyes. So, can you look up at me? Okay, her eyes are brown. Her eyelashes are nice and thick, along with her eyebrows. Can you raise your eyebrows for me? Okay, so cranial nerve 7 is intact. Can you puff out your cheeks? Okay, so cranial nerve 7 is intact, and cranial nerve 5. So her eyes are brown. Look at me. And her pupils are round, 4 milliliters bilaterally. Her eyes are symmetric, along with her face is symmetric, and her head. Her sclera is white. I'm going to check her conjunctiva. Open your eyes. Okay, there's no redness. And then, do you have any difficulty seeing at all?
No.
Okay, and then I'm gonna do pupil constriction. And that is strict and consent bilaterally. I'm gonna have you watch this pen. So for Perla, pupils are equal, round, reactive to light, and accommodate. And then I'm gonna do the 6 cardinal gazes, so if you can follow this pen. Okay, so cranial nerves 3, 4, and 6 are intact. And then no opacities on the cornea. Next, I'm gonna go to her nose. I noticed that the skin color is the same as the rest of her face. I don't see any lesions or masses. Do you feel any tenderness when I touch your nose?
No.
Okay, I'm gonna check her maxillary sinuses, and then her frontal. Did you have any feel any pressure or tenderness when I did that?
No.
Okay, can you grab one side of your nose and sniff, and then the other side? Okay, nostrils are patent bilaterally. I'm gonna look in your nose. I don't see any deviations or perforations. Nostrils are symmetrical. They're pink and moist. And then, do you have any difficulty smelling?
No.
Okay, so cranial nerve 1 is intact. And then for the vision, cranial number 2, we would have done a Snellen vision test where she would cover up one eye. So cranial nerve number 2 would be intact. Next, we're gonna go to her mouth. I noticed that her lips are symmetrical. Her lips are pink and moist, no signs of dryness. I'm gonna have you open your mouth for me.
Oops.
Okay, I noticed that all of her teeth are intact. She is wearing braces. Can you stick your tongue out for me? Move it back and forth. So cranial nerve 12 is intact. Buccal mucosa is pink, and soft palate and hard palate is nice and pink. Can you say ah? Uvulus midline tonsils would be a 2 for grading, and her pharyngeal, well, I'll say ah again, is nice and pink. I'm gonna look at her gums. Them are pink, no signs of bleeding. I didn't see any sores in her mouth. So cranial nerves 9, 10, and 12 are intact. Next, we're gonna go to her ears. I noticed that her ears are symmetrical bilaterally. The tip of her ear lines up with the canthus of her outer eye. Do you get a lot of ear infections or drainage from your ears ever?
No.
Okay, so I'm gonna look inside of her ears. Nice and clean. Same with that one, so they're clean bilaterally. I'm gonna pull up on the pinna, and then I'm gonna press down on the tragus, and then on the mastoid process. Do you feel any pain or tenderness?
No.
Okay, so cranial nerve number 8 is intact. We would do a whisper test. And then I'm going to start with the neck now. So I don't see any abnormal swelling on her neck or on her face. I'm going to palpate for her thyroid gland. No abnormalities there. I'm going to have you shrug your shoulders for me. Cranial nerve number 11 is intact. Can you move your head back and forth? Okay, so she has no difficulties with range of motion. And then I'm going to start by palpating the lymph nodes. So start with the preauricular, the postauricular, the occipital, the jugulogastric, the segmental, submandibular, and then the submental, and then the superficial cervical, and then can you turn your head that way for me? And the posterior cervical. Okay, and turn your head the opposite way. Posterior cervical, and then the supraclavicular. You can look back at me now. And then the deep clavicle. And I didn't notice any swelling or abnormalities on her lymph nodes. And next, we'll start with her actually we're gonna do jugular vein distension. So actually, can I have you lay back down? Okay, and then sit up. And there's no signs of jugular vein distension bilaterally. I'm gonna listen for bruits after I palpate her carotid artery. That's a 2+ bilaterally. Now I'm gonna listen for bruits with the bell side of my stethoscope. Okay, and no signs of bruits. Next, I'm gonna start with her upper extremities. So I'm gonna look at her skin. The hair is evenly bilaterally, and I don't feel any lesions or masses. No signs of edema. Her arms are symmetrical for capillary refill. It's less than 3 seconds bilaterally. So again, no bruising on her skin, no signs of rashes. Her temp is warm and dry, no moisture bilaterally. And then we'll do I'm gonna have you squeeze my fingers. Okay, strength is equal bilaterally. Then I'm gonna push towards you and try and stop me. Okay, then I'm gonna pull and try and stop me. And so our strength is equal bilaterally. And then we can start, we'll do our lower extremities now. So, pull up her. So for her legs, again, the color is the same as the rest of her body, skin color. Her temp is warm, and there's no signs of moisture. For edema would be rated 0. There's her hair is evenly bilaterally for capillary refill. It's less than 3 seconds bilaterally. I'm going to check for dorsalis pedis pulse. That's a 2+. 2 plus bilaterally, and then I'm gonna do her posterior tibial. That's a 2 plus. Two plus bilaterally. Okay, so then I'm gonna do the strength for the lower extremities. I'm gonna have you press down. Okay, and then raise your feet up. Okay, so strength is equal bilaterally, and then I'm gonna check your radial pulse real fast. Okay, 2 plus. 2 plus bilaterally, and then I'm gonna do your and then her brachial is 2 plus bilaterally also. So now I'm actually gonna have you stand up, and can you come stand right over here? Okay, stop actually. I'm gonna have you stand, face this way, and I'm gonna have you walk to the end of this bed. So her gait is normal, and then can you turn around and then go back and put one heel at your toe, in front of your toe, and then walk. Okay, and the patient has no difficulties performing that. And then I'm gonna have you do the Romberg's test. If you can stand like this and shut your eyes with your feet together. Okay, the patient has no problems doing that. She wasn't swaying left to right. So, cranial nerve 8 is intact, and then I'm going to have you lay back down on the bed. And I'm gonna have you do the heel to shin. And the other side. And she had no difficulties performing that. So, next we're gonna do the thorax and lung, but can you sit up for 1 second? I forgot to do one test with you for the eyes, so I'm gonna have you, you're gonna touch your nose and then touch my finger. Okay, and the patient had no problems doing that, so that's normal. And then for the thorax and lungs, so I'm gonna start by looking at the anterior side and press down for any crepitus. No signs of crepitus. So then I'm gonna start by percussing. So I'm gonna go down to the angle of Louis over to the second intercostal space. Percussions were normal. And then I'm gonna auscultate. Okay, I'm gonna start at the apices of the lung. Can you take a deep breath in? Let it out. Again. 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 And again. Okay, the lungs sound clear. There was no rhonchi or crackles. noted, and then her skin also again is warm, no moisture. Skin's same as the rest of the color of the body, and then I'm going to have you turn around, and we're gonna do the posterior side. I need you to face that way when you turn though. Can you come right here actually and sit. Okay, so I'm gonna feel for any crepitus. I notice that the skin's warm, dry, no signs of moisture. There's no lesions or masses, and its symmetry is equal bilaterally. No signs of scoliosis. And then I'm gonna do tactile fremitus. So I'm gonna have you tactile, yeah. So I'm gonna have you say 99.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
And the vibrations diminish as moving downward bilaterally, and then I'm gonna start by percussing. I'm gonna find T7, which is right here. I'm gonna go down to T1. And then right here would be where T7 would be. Here, I'm gonna pull this up, okay? Where T7 would be, so I'm gonna, so T7, 8, 9, 10. I'm gonna go over to T8, and then up to T6, sorry. Oh, same on the other side. 8, 9, 10. So I'm gonna go over to T8 and up to T6. And percussion, that all sounded fine. There wasn't any abnormalities there. And then I'm gonna check for equal expansion. So fine. T7, it's right there. 8, 9, 10. So maybe take a deep breath in and let it out. So it's equal expansion there. Then I'm gonna do for AP diameter. So you sit still for a second. So ratio would be 1 to 2. And then I'm gonna auscultate over all the lung fields. Start at the apices. Can you take a deep breath in? Again. 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 And again. And again. Okay, so all lung fields sounded normal. There was again no crackles, bronchi, or no signs of wheezing. So then we're gonna do we'll do the heart, and so if you can turn around again, look at me. Okay, and do you have any, have you ever had any cardiac problems at all?
No.
Okay, so can you turn this way actually a little bit towards the camera? Okay, so I'm gonna start by inspecting. Again, there's no lesions or masses. Skin color is the same as the rest of the body. I don't notice any respiratory distress. So I'm gonna mark out my findings. I'm gonna start with the second intercostal space, which is the aortic on the right side, and I'm gonna listen. Take a deep breath in. And I'm gonna move over to the second intercostal space on the left side, which is the pulmonic. Deep breath in. Okay, and then I'm gonna move down one to Herb's Point. And then I'm gonna move down to the fifth intercostal space, and I'm gonna take a deep breath in. And that's a tricuspid. I'm gonna move over one to the mitral. Deep breath in. Okay, and S1 and S2 sounded normal. There was no signs of murmurs or anything. So next we're gonna do, I can have you lay down and we can do your abdomen.
This one?
Yep, just like that. So I'm gonna lift up your shirt, and then, so I'm looking at your abdomen. For contour, it's flat. There's her umbilicus is midline, and then I don't see no signs of distended veins or anything like that. Her temp is warm, dry, like the rest of her skin, and there's no hair or anything. Her skin's nice and smooth. So when we start with the abdomen, I'm gonna begin by I'm gonna auscultate first. I'm gonna start in the right lower quadrant. Go to the right upper quadrant. The left upper quadrant. And then the left lower quadrant. Bowel sounds are active. And then I'm gonna do for the renal. Actually, I gotta switch that over for the bowel to listen for bruits. So I'm moving it over to listen to the aorta. No signs of bruits. This is for the iliac. And no signs of bruits. While I have her like this, I'm going to look at the apical, which is located right next to the mitral. There's no signs of heaves or lifts there. And then, so next, I'm gonna percuss all 4 quadrants, so. Right lower, right upper quadrant, left upper quadrant, and left lower quadrant. And percussion is normal, there's no signs of dullness or anything. And then next I'm gonna palpate. Do you have any pain or tenderness in your abdomen?
No.
No? Okay, so I'm gonna start with light palpation. In the right lower quadrant, in the right upper quadrant, the left upper quadrant, and then the left lower quadrant. No pain or tenderness? Okay, so now I'm gonna do deep palpation. In the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. And no pain or tenderness?
No.
Okay, so I just wanted to look at your nails real fast. Know that the shape of them are square. The capillary refill was good. And then for her toes, her nails are square too, square shape. The contour's flat for hands and feet bilaterally. Her legs are symmetrical bilaterally. And then her skin tone for her whole body is nice and tan with pink undertones. All of her skin was warm and dry, no signs of moisture. I just want to go back through the cranial nerves to make sure I got them all. So for cranial nerve number 1 would be for smelling, that was intact. For cranial nerve number 2, her vision was intact. For 3, for the eyes, that was intact. And for cranial number 4, for the eyes intact. And then cranial nerve number 5 for the face was intact. 6 again for the eyes was intact. Cranial nerve number 7 for her eyebrows and below her cheeks was intact. Cranial nerve number 8 for her ears and Romberg's test was intact. Then for 9, 10, and 12 was intact. 9 for the gag reflex. And then for cranial nerve number 11 for her shoulder shrug was intact. That was fine. One more thing, I'm gonna have you sit up real fast. For the upper, I was gonna have you press against my face. And other side. And so that was equal bilaterally. And after the assessment, I'd make sure the patient was comfortable where she was sitting at, make sure the call light is nearby, and then I would perform hand hygiene and finish charting and documenting.